This portion of New Day Northwest is sponsored by Aesthetic Rejuvenation by Dr. Brecht.
During the summer, we have more opportunities to be self-conscious about how we look in swimsuits, shorts, and tank tops. Now I'm depressing myself. Dr. Christina Brecht from Aesthetic Rejuvenation is here to tell us about a few simple procedures that can be done even when you're awake to help you feel better about how you look. Welcome. All right. What are awake liposuctions? Because it sounds a little bit scary.
Yeah, it's not scary at all. It's the newer evolution of liposuction and cosmetic surgery, and basically it's just safer, easier ways for patients to do liposuction, body sculpting techniques. Better results, less downtime.
And I think you've said before that you prefer it because you just feel better about the patient, and they feel safer and more secure with you to be awake.
Well, I prefer it in a couple of ways. I have more control in actually sculpting. You know, everybody who comes in is their own personal artwork. And so we're basically sculpting and optimizing their bodies in whatever way. But it's safer. They literally sit up after the procedure. They can walk home. They walk with their caretaker to the car, and then they walk in the next day. And you know, the recovery is just so much more streamlined and safer, and the results are better. And it's just a great procedure.
Well, we have some pictures that are pretty amazing. We're talking about arms, but there's some other things that we've done here. So tell us what we're seeing here.
Yeah, so in this case, we did a few things. We did love handles and fat transfer to her bottom and inner arms. And what's interesting about these pictures is, so we didn't have to do the traditional arm lift type procedure. We just basically went in, made teeny tiny little incision up by the elbow, and I was able to remove fat from the inner arm.
Wow.
And I do a technique as well while I'm inside, kind of helping to tighten the skin from the inside. So I use a combination of body jet, water jet technology, and power jet, Power X technology, and those just really help tighten the skin from the inside, as well as removing that volume.
You can really see it. And then I think we have the same from the patient from the front.
Yeah, this is the front, so you can see the arms before and after, and then the tummy. And keep in mind, this is actually just the day after.
Wow. So it's going to get better and better.
Oh yeah. Now this is when there's the most swelling. You know, if there's bruising, there would be bruising, but there's no bruising, and this is day one. And really, the swelling is minimal, but I mean, it's usually, I say that first month is when you're going to have the most amount of healing.
And you can see you did the tummy,
and so you can see already. And so I did this on purpose so people could see the day after. You know, there's not much bruising, and there's there's very little swelling. Although I say there is swelling.
Right.
You know, usually I say to people, you're going to need to go down. If you're a size large, probably a medium or small within the first couple of weeks. So, you know, I tell them, don't go out and buy a bunch of things yet. Just wait.
It's going to get better and better.
It gets better
and
better.
You were saying you make tiny little incisions in the arms. We were talking earlier. Yeah. It used to be that your only option to have your arms reduced would be to have a very nasty looking scar.
Right.
And that isn't so anymore with this. You can see here.
We are finding, here's another patient. So we did her inner arms, and you could see already after that her inner arms were getting a lot tighter and firmer. And what we're finding is that with these techniques, by removing that volume, that we're actually getting a lot better skin tightening than we thought we used to. Now, you know, there are some people whose arms are just huge, 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 and that option where you just have to trim the skin away is still the best option. But we're finding that a lot more people, they don't have to do that. And this is an easy straightforward
This is the same
procedure.
patient, just the front.
It takes, less than an hour. Yeah, so we did a little of her axilla fat as well. You can see where the markings are.
Is
as
that
well as
side?
That's like that side. It's like that upper bra,
the bra
pudge
bulge
stuff.
The bra bulge, right.
Exactly. And so we did a little of that, and it's all about sculpting. And then her inner arms as well. And so you can see how it just sculpts the arms, and these are areas genetically sometimes we just inherit it, and so you can be slim and trim and still have big arms, and people feel self-conscious. They're like, I can't fit into my summer dresses, or I have to buy shirts with bigger sleeves, and so this is just a really easy procedure that I can do in our OR that gives patients just that that little extra bit of confidence to wear what they want to wear.
And what other procedures can be done while the patient's awake?
Oh, so we can do full mommy makeovers, which is breast lifts and tummy tucks, body lifts. So we can do the tummy tuck, the thigh lift, the back. Sometimes people need the back lift too. You can do thigh lifts, arm lifts, neck lifts. You can do face lifts. I mean, you can do pretty much now any technique that involves surface skin. You can.
And quickly, the cost for lipo?
So one site is as low as $950 for one site. And so in some of these patients, upper, lower tummy is, those are a couple different sites. And inner arms, sometimes I count it as one site if it's just a little bit, but if it goes all the way down to the elbow, then each arm is considered its own individual site. So it really depends on the patient.
Okay.
Yeah.
Thank you so much.
Yeah.
And Dr. Brecht will be right back to join us on this week's Wellness Wednesday panel and answer some of your questions. We'll see you in a minute.